Sorry, there was a network, there was a technical issue with this. So we were talking about this Brinia's aggravation from any motion and corresponding relief from absolute rest, either mental or physical. Okay, so this, if you are getting a patient of that from from least motion, the patient is aggravated. Okay, the least motion, that is a different thing. You have to differentiate between the motion and jerk. Belladonna patient will be aggravated even by jerk. Okay, patient are people are running through the floor or walking to the floor, it will produce a jerk and patient is aggravated. That is a different thing. To differentiate, if you are taking the symptoms wrongly, you will get a wrong medicine. Okay, so that is the different acumen to differentiate between two, finally differentiate between two symptoms. Okay, so this aggravation from motion is one of the characteristics of brainia. Okay, only one of the characteristics. What we are doing, we are keeping in mind. So keynote prescribers, what they actually do is they try to search at least three symptoms. Okay, as they say, there is a three-legged stool. Stool should have three legs. Okay, a stool should have three legs. So along with it, if you are getting a constipation, if you are getting great thirst, if you are getting uh, irritation of the body and mind, for the brainia, it is brainia. You need not to search whole of the syndrome. These three symptoms, if commandly you are getting, if you are getting appropriately these three symptoms, you can confidently prescribe brainia. Okay, so there is one school of keynote prescribers, but in this also, you are going to differentiate the symptoms. Means if you are taking the symptoms incorrectly, the symptoms should be bold in the patient, bold in your medicine also. The symptom is not that bold in the patient. Aggravation from the least motion is not that characteristics for your patient, and you are giving brainia. This is not good. So first you have to sharpen your skill of taking the case. Which symptoms you have to value, those symptoms which are being promptly said by the patient. You ask what is your desire and patient promptly said you. That is more important than you have given the option to the patient and then only you are getting the result. That is less important than the promptly said one. Okay, so this least aggravation, if you have observed, by your observation the patient is aggravated. One of the stalwart we have heard about that, when he went to the patient's bed and asked, how are you, a patient move a little bit and there was diarrhea. The teacher prescribed brainia because there was an aggravation by this least motion. So that was the fine observation of the previous stalwarts. They were able to differentiate between the grades of the symptoms patients are giving, and they were able to interpret symptoms correctly, whether there is motion, aggravation from motion, or whether there is aggravation from jerk. Okay, so you have to, from where you will learn, you will learn this from the practice. But what to learn, you are learning now. Okay, from your clinical practice you will develop these skill. As you will get older in your practice, you will uh, acquire these skills unknowingly, unconsciously. But first you have to know what you don't know. uh, if you are that I'm self-sufficient, I know everything, so you have closed your lid to learning. Patients are teaching you every day patients are teaching you every day, but first you have to know what you lack. So these are the learning opportunities you should utilize in your clinic, that how to differentiate between two symptoms, how to interpret a symptom. Okay, Like how to interpretate a symptoms. There is a side topic. Let's means coming into my mind. Go to pulsatilla. Go to pulsatilla, and there is last line above relationship. Nervousness intensely felt about the ankles. You don't know what symptoms is telling you. Nervousness intensely felt about ankles. You don't know what these symptoms and how to interpret it. Okay. Nervousness intensely felt about ankles. But this is though here given in third grade, but it is if you are finding this. डॉक्टर इस यहाँ पर एक केस आई गॉट वन सिंगल केस दैट डॉक्टर यहाँ पर मुझे कुछ कुछ लगता है, पता नहीं क्या होता है. दिस इज आई एम फीलिंग हियर, सो आई इंटरप्रिटेटेड एट नर्वसनेस फेल्ट इट ankle. Okay, so some symptoms you have to interpret with the modern scenario, with the present age. Some symptoms you have to differentiate between two symptoms, and some symptoms you have to evaluate according to grade. Okay, so this was the keynote. Some people are saying that 3-leg stool, if you are getting 3 leg, it is, if you are getting 3 legs, yani 3 characteristic symptoms, you don't need to search the whole symptom syndrome, you can prescribe it. Okay, so in Calcutta mostly, and in India, those who are following Hahnemann, Bonninghausen, then Allen's tradition. Okay, Hahnemann, Bonninghausen, and Allen's. This is a school of thoughts. Okay, and those Hahnemann, Bonninghausen, Allen. Okay, school of thought. One, those who are following this, they are giving more important to these characteristics. Okay, now one school of deviation is Hahnemann to Kent directly, or you can say in between Herring comes and then Kent. Okay, Herring was to some extent from Bonninghausen, but this Kent, you can say Herring and Hahnemann. Okay, they have interpreted, mostly Kent have interpreted things totally in a different way. Okay, that is more toward metaphysical sphere, and that is more toward from this Kentian school. All of the latest theory of discovering medicines have evolved. Means by theme, people are searching by theme, people are searching by miasm, people are searching by this and that. Every means they are searching, we respect them, but that is not easily comprehensible. What we have read in aphorism number 2, that should be easily easily comprehensible, should be based on easily comprehensible principle. But what people are doing, from Kent up to Kent is okay, but from Kent a flood of these type of interpretation of symptoms have came. Okay, now better not to indulge us. It should be easily comprehensible, and this school of thought, this Hahnemann, Bonninghausen, and Allen, okay, this school is better we stick to ourselves to this only. Okay, Kent's method is up to Kent, not beyond Kent. Kent's method is sometimes easier to practice, but to whom? Those who have mastered in this school, from this school. Okay, mastered from this school, then only they can prescribe basing on Kent's method. Okay, so we were uh, in this discussion of 3-legged stool. Okay, 3-leg, if there is 3-leg, you can sit on that. Okay, but some people are there who are telling there is a single leg. If there is a single leg and it is having a grit enough, मोटा एक बहुत marked symptom है, well marked symptom, running through whole, grand general symptom, running through whole of the remedy. You can prescribe upon that also. Okay, so this type of prescription you will find in Calcutta school, where they are prescribing if this is well marked grand general symptom running through all of the it is characteristics in the patient, characteristics in your remedy, and it is present in throughout the symptomatology. Okay, so you can see this. Open pulsatilla again. Pulsatilla. Thirstlessness with nearly all complaint. This thirstlessness. One second. नहीं, हम नहीं बोल सकते, हम नहीं दे सकते, सॉरी। हम अपना साफ करने वाला रखे हैं, ठीक है। Okay, so thirstlessness with nearly all complaint. Thirstlessness you are seeing in bold. These people who are following this single symptoms, if the single symptoms is strong enough to make a stable stool to sit on, then you will take that symptom. Okay, so open Nux moscata. Nux this all elements 1, 2, 3, 4th paragraph, Nux moscata. All elements are accompanied by drowsiness and sleepiness. All elements are accompanied by drowsiness and sleepiness. Okay. Open Antium crude. This Antium crude. Thick milky white coating on tongue, which is the red strand of the remedy. Which is the red strand of the remedy. You will see that in this school, Hahnemann, Bonningussen, Allen. In this school, characteristics is characteristics. Wherever you are finding it, okay, you are finding in tongue, it is characteristics. You are finding in mental sphere, it is characteristics. You are finding in general sphere, it is characteristics. You are finding in physical sphere, it is characteristics. But this Kenshin school is problematic with this. They are giving more importance to this mental sphere. So it's quite confusing for a beginner to what to take and what to leave, and how to interpret it or how to get these mental symptoms. But in this Hahnemann, Bonningussen and Allen school, This is characteristics is what characteristics? Whatever, wherever it is present, you are taking it as characteristics. Okay. So I will suggest you not to indulge yourself more in the trying to get the mental symptoms. Bonning Hussain knew the mental importance of mental symptom. Hahnemann knew the importance of mental symptom. That is why he have told that chiefly determine the disposition 211, 211 chiefly determine the this selection of remedy. Hahnemann knew that, but they also knew that it is one of the most difficult thing to get. Okay, so the Keynesian school have actually propagated this mind, mental symptoms, physical symptoms, mental general, physical generals, and all that evaluation. All is good for your examination purpose, but not for your clinical purpose. Okay, you will get confused. So try to stick to this school of characteristics. Okay, try to learn the characteristics. I am not telling it. It is told by this one of the Elizabeth Wright, a book by Elizabeth Wright, which I recommend you to go through, a brief introduction of homeopathy by Elizabeth Wright. So try to learn the characteristics of at least those drugs which are there in Allen. Begin with 26 or 25 remedy and then expand your reach. Okay. Try to learn the drugs first, the characteristics of them. Okay. So knowing the Materia Medica is okay until and unless you know your case taking. Okay, you have to match. No, you have to match this. Case taking में गड़बड़ हुआ, आप इसको match करते रह जाओगे, कभी नहीं होगा. Okay, so this should be matched with the list of what he is telling. The list of symptoms of the natural disease you have collected, the list of symptoms you have collected from natural disease should be matched with the list of the drug. And in that list, you will get some of the characteristics which should be present here as in the medicine also as characteristics. Okay, I hope this topic is a bit clearer to you of characteristics, PQRS, and how to use in clinic. If you have any question, as none of you are here now, so you can ask these questions in WhatsApp group. If you have any question regarding clinical application of these keynotes, you can ask in WhatsApp group or you can ping me personally on WhatsApp. We will meet on next Sunday, same timing, 10 or 10:30. We will meet next Sunday. We will try and continue our classes every Sunday for next few weeks. Thank you.